So the topic of our lecture is liver, gallbladder, and the pancreas. And today we are going to talk about digestive system glands, and we start from the functions of the liver. Before investigating the structure, it's very important to understand what functions this organ performs. The first and one of the most important is to produce blood plasma proteins of different kinds, like albumins regulating the osmotic pressure of the blood plasma, prothrombin regulate together with fibrinogen, they regulate the blood clotting, transferins, lipoproteins, there's a transport fraction which helps to transport some and other elements in our bloodstream. So hepatocytes, and this is the name of the typical cell in our liver, hepatocytes, they have a very well developed rough endoplasmic reticulum, and lots of proteins are produced here and excreted to the blood. After that, in hepatocytes in the liver in general, we can see and find the storage of different lipids, sugars, carbohydrates, vitamins, and many other substances. As you may see here, A, D, K vitamins are metabolized in the liver. Vitamin A concentration is regulated in the blood plasma because of specific cells called hepatic stellate cells. Vitamin D is hydroxylated in some another set of cells present in our sinusoids. And vitamin K is absorbed from the small and large intestines and is transported also to the liver. So it regulates the concentration of vitamins, different micro elements, and very important glucose concentration, as well as exchange of lipids. So it has very well developed smooth endoplasmic reticulum as well. Next, it produces bile. Really, the bile is very important for emulgation of lipids in our small intestine, and it is produced also by the smooth endoplasmic reticulum and the Golgi complex. After that, very important function is drug detoxification. Here, different toxins transported with a portal blood from our small and large intestines, possibly ingested with the food and some drugs prescribing to be taken per os. And here again, smooth endoplasmic reticulum as well as peroxisomes neutralize them, and we'll discuss this function in details, of course. And as well, liver participates in the concentration or in regulation of hormone concentration. Some hormones are inactivated in the liver, so it performs lots of very important functions. This is the largest exocrine gland in our organism. So let's pay attention to some of its roles in details. First of all, drug detoxification. It has several phases. During the first, the cytochrome P450 in the smooth endoplasmic reticulum, it hydroxylates different substances, making them more soluble and making them more polar comparing with the initial state. So they are readily dissolved in the water. During the next step, conjugation takes place. So those substances are conjugated with some polar molecules like glucuronic acid or glycine. And taken together, those measures are needed to facilitate the excretion of drugs together with urine with the help of our kidneys. And in this diagram, with the help of fluorescent microscopy, different and multiple peroxisomes are shown in hepatocytes. You see them with a red color. So they're very important in different drug metabolism. So nowadays pharmacogenetics is very popular. When before prescribing some special drugs, first of all, the genotyping is performed, estimating the set of enzymes which are present in this particular patient's peroxisomes. So to understand whether this particular drug will be effective in this particular patient, first of all, peroxisomes are analyzed, and after that, the drug is chosen. So it is very important to understand. Then, as for lipoproteins, so we have to mention that as liver regulates the exchange of lipids, of course, this is the subject of biochemistry, but you should remember from the beginning the really exchange and metabolism of lipids is tightly associated with a risk of cardiovascular diseases. And remember from the second year that our cholesterol circulating in the bloodstream could be included in different fractions. First of all, lipids cannot be transported through the bloodstream themselves. They should be always encoded with the proteins, as of course they are hydrophobic and they should have the hydrophilic shell around them. And there are several subtypes of those lipoproteins or transport forms of those lipids. One of them is the low-density lipids. These are the lipids containing cholesterol, including cholesterol, which are transported from the liver to the peripheral organs. So these are the dangerous lipids, and they include cholesterol. And if, as it is written here, if the concentration of this fraction is increased, so patient it has a high risk of cardiovascular diseases, particularly atherosclerosis. While high-density lipoproteins, they have instead the transport form of cholesterol, which is transported from the peripheral organs to the liver. So it is instead very, how to say, it has the good prediction significance. So if patient has high concentration of high density or low concentration of low density lipoproteins, this is a good predictable sign for the doctor. Okay, so let's move on, and the last function of liver we are going to discuss. This is the exchange of hormones. This information is given because it is absent in your basic textbooks, so the lecture is used like a complement to your textbook. We do not pay attention to different and other roles because they are very well explained there. Yeah, but please pay attention. In the liver, some hormones like T4 is converted into T3. You know that it is the active form, and it's the very important function. Then it liver, also regulates the concentrate of the activity, of the growth hormone, producing its activator like insulin-like growth factor, and also somatostatin, which inhibits the activity of the growth hormone. Besides somatostatin, it has also another functions. I will return to them. And at last, insulin and glucagon, they are degraded in the liver, and in this way liver participates in the exchange of glucose, which is very important function. So after we have discussed functions, let's investigate the structure, how liver is organized, and how all those hepatocytes are organized around blood vessels to perform their function as effectively as it is possible. So if we make the cross-section through the liver as an organ, we'll find there those hexagonal structures, which are called classic liver lobules. So the liver tissue of the liver is subdivided into regularly repeated particles, and if we investigate the structure of one of those particles, we'll investigate the structure and function of the whole organ. That's why this particle is called morpho-functional unit. So the unit which performs the function and represents the unit of the structure at the same time. Let's investigate how it is organized. The architecture, the backbone of the lobule, is built of vessels. So at the periphery of the lobule, we can find so-called triads. Triads, this is the combination of three. This is the interlobular artery, interlobular venule, and also the bile duct. If to be exact, there is also the lymphatic capillary present. So triads, this is not a very correct name for those structures, but it was accepted and it was used for many years. So now it is also widely used. While you should imply that there are more than three structures combined together at the periphery of the classic liver lobule. So what is especially interesting, notice that liver, it has two vessels bringing blood to its circulation, and liver is a unique organ in these terms, as it receives not only arterial blood, but venous as well. And we have to understand why liver needs this deoxygenated blood. Like in the pituitary gland, we have already discussed, it has capillary network, which is supplied by the venule, by the hypophyseal portal venules here. And really, they do not bring oxygen, they bring hormones, they have another destination. So sometimes blood vessels deliver blood not for oxygen, not for, oxygen supply and nutrients, but with another purposes. And liver is a very good example. It receives portal vein, which collects blood from all organs of abdominal cavity, and there are predominantly organs of digestive system are located. These are small and large intestine, where the process of absorption takes place. So all those nutrients, might be several toxins, are absorbed and delivered to the liver to be filtrated, to be inactivated. As we have already discussed, they are hydroxylated and conjugated. After that, they could be dissolved in the blood plasma and excreted with the kidneys. So the purpose of the venous tributaries is to deliver blood full with those substances absorbed in the small and large intestine. And of course, after being absorbed, different even nutrients, they shouldn't be transported to our vital organ like brain, heart, lungs. That's why first they pass through the liver and then the vena cava inferior only, and only after liver absorbs all those nutrients, normalizes the concentration of sugars, lipids, vitamins, and many other components. Only after that, blood enters heart, lungs, and our brain. So inside the liver, not only toxins are absorbed, but also nutrients, and concentration of many substances is balanced. So let's return to the classic liver lobule. Now we understand it receives not only arterial blood for oxygen supply, but as well venous blood. Both those arterial and venule, they have inlet venule and inlet arterial. They fuse, and with their confluence we have the sinusoidal capillaries. You remember that liver is one of examples for the location of the discontinuous or sinusoidal capillaries, which are the most permeable, because here active exchange of metabolites takes place. As we have already discussed how many functions liver performs, and loads of, and predominantly all of those functions are connected with the blood. Then after sinusoids, there is the central vein, which is located in the center of the classic liver lobule, and after exchange of metabolites, oxygen, gases, deoxygenated blood with balanced concentration of different substances enters the central vein, and out of there, through the sublobular vein, it exits the organ with the help of the hepatic vein. So on its way, blood which is delivered to the liver percolates through the system of sinusoids, which are radially located in the classic liver lobule. On their way, sinusoids are surrounded with hepatocytes, and blood actively interacts with hepatocytes, and after that enters the central vein. So the direction of the blood flow from the periphery to the center. And if we are talking about the bile secretion, we should mention that hepatocytes are the same way. They produce components for the bile, but the direction of bile flow is opposite. Hepatocytes form blind-ended bile canaliculi and produce bile, which is transported to the bile ducts located in the portal triads. So the blood direction is opposite to the bile direction, and these are the classic liver lobule. Then once again here the hepatocytes are added to the diagram to make it more realistic. So in the center, central venule and the periphery portal triads, and in between them sinusoidal capillaries, which are located between hepatocytes. Notice that every particular hepatocyte is simultaneously in contact with two different mediums, bile on the one side in its bile pole and blood on the opposite pole, so vascular pole it is called. So every hepatocyte exchanges substances with both liquids, while they are not mixed one with another because of the tight junctions which are present between hepatocytes. You know, those junctions, they seal the intercellular spaces, preventing two liquids from mixing. But in case of viral infection, for example hepatitis viruses, they break down those tight junctions, allowing mixture of bile and blood. So jaundice develops in this case a very undesirable effect. Under normal circumstances, two substances are properly insulated. And notice again, blood from the vein and artery, they're coming in one direction, while bile is in a quite opposite. Yeah, and liver is not so simple as it seems, as it performs many functions. Different types of morphofunctional units are considered in the liver, because if we are talking about the blood circulation, it is convenient to consider the classic liver lobule. But if we are talking about the bile secretion, we consider the portal lobule. Portal lobule is a conditional morphofunctional unit, which has triangular shape, and it is located between the central veins, which are located at its corners, and in the center of the portal lobule there is a triad. So why portal lobule is considered? Because here bile moves from the periphery to the center. So if some troubles occur with the bile secretion, we should understand that here in the periportal space, a zone will be affected at the beginning of the mechanical jaundice, for example. So triangular portal lobule is considered in case of is considered to better understand the function of the liver, like production of the bile. Then, in the portal acinus is quite another morphofunctional unit, which is rhomboid in shape, and it has triads near the blunt angles and central veins in the sharp angles. So, what is the essence of considering the portal acinus? The essence is that it emphasizes that the distance between the two triads is shorter than the distance between the central veins. So, the degree of oxygen supply is not equal among those zones, and between the portal triads the most oxygenated zone is located. After that, less oxygenated, and around central veins the least oxygenated zone, because it is far from arteries. So in case of different diseases like ischemia, when the concentration of oxygen is decreased in the blood, in the circulating blood, the third zone would be affected first of all, as it is least oxygenated, so it suffers from hypoxia first of all. In case of viral infection, viruses should be spread first of all. If they are spread with the blood, with arterial blood, yeah, they should affect first the first zone. So the portal acinus helps a pathologist to understand the different zones in the liver. They are not equal, and analyzing the damage, in what zone this damage takes place, they may suspect one or another pathology or exclude them. So portal acinus, it has high significance, high clinical significance for pathologists. Okay, so remember, and let's summarize. Liver, it has three conditional morphofunctional units. The first, classic liver lobule, it is more or less structural, because in some animals it is surrounded by the connective tissue, but in humans it is not. So in the classic liver lobule, from triads, blood moves to the center. Then in portal lobule, instead bile moves to the center, so bile concentrating function is considered here. And portal acinus, rhomboid in shape, and it highlights the difference of oxygen supply in different zones. Okay, let's move on. So here liver acinus is again shown to classic liver lobules, and the portal acinus is shown with the first, second, and the third zone. As we have discussed, the zone around the central vein is the least oxygenated. So after we have discussed the liver blood supply, different morphofunctional units of the liver, we have to discuss its vessels, its unique sinusoids. Sinusoids are capillaries where exchange of nutrients, maybe toxins, gases take place. Lots of substances are exchanged. And what's unusual with those sinusoids? First of all, they are lined not only by endothelial cells, but also by Kupffer cells. We are going to discuss them later. So if you look at this diagram, you'll find out that here endothelial cells are present as in all other type of capillaries here, but also those Kupffer cells, which are macrophages in their nature, they line capillaries together with endothelial cells. Then these sinusoids, they have basement membrane which is very poorly developed, and moreover sometimes it is even absent. So the blood is as close to the hepatocytes as it is possible. After that, inside sinusoids, do not forget, mixed blood circulates because sinusoids, they receive blood both from vein and artery, which is unusual. And those capillaries, they are surrounded with a so-called space of descent. Here it is written, mentioned. So usually capillaries are in close proximity with the cells surrounding them, but in this particular case there is a distance between them because there are lots of microvilli of hepatocytes located, allowing them to increase the surface area and to improve the exchange of different components. Notice here is the scanning electron micrograph is given, showing us the interior lining of those sinusoids. You may see lots of perforations because capillaries, they are called discontinuous because endothelium is highly perforated. So now we have to discuss some cells associated with those liver sinusoids. And first of all, these are Kupffer cells. They are shown in blue color in this scanning electron micrograph. It is artificially colored, of course. Originally it is black and white. And first of all, those cells, they derive from monocytes of our bloodstream. After that, they provide the immune surveillance locally. So they not only phagocytose debris and rubbish material, but also they present antigens to lymphocytes. Then they phagocytose not only bacterial or foreign antigens, but as well red blood cells. And in this way, they help spleen to perform its function. Yeah, but the essence not only to destroy red blood cells, but to obtain heme out of there and to convert it into the bile. So Kupffer cells, they participate in the exchange of heme, and they deliver the substrate to hepatocytes for bile secretion. So you know that bile pigments, bile acids, they are the steps of hemoglobin degradation. And also those cells, they participate in the hydroxylation of the vitamin D. As we have mentioned at the beginning of the lecture, vitamin D is hydroxylated in the liver. You know, this vitamin is produced in the skin, after that hydroxylated in the liver, then it goes to the kidneys where it is hydroxylated one more time, and only after that it performs its function, which is very important for calcium metabolism. So remember that, please, and later in the topic skin and urinary system, we'll return to this vitamin, and those steps will be considered there. So Kupffer cells are present, and they actively interact with the next type of cells, which is pit cells. They are called pit because there are dense granules in their cytoplasm, resembling some seeds, little seeds inside, okay, as it is explained in the slide. And notice they represent the fraction of resident natural killers, very important cells, as they provide the anti-tumor activity. As you remember, natural killer lymphocytes, they are not T lymphocytes, no B, but natural killers. They fight not against antigens or foreign agents, but against cells of our own body. They find suspicious cells like virally infected or maybe transformed, like after mutation or irradiation, and they inject pro-apoptotic enzymes inside. So in the liver, those natural killer cells, they provide the function of anti-tumor immunity. And also some natural killers, of course, they circulate in the blood plasma, and they might come to help resident natural killers. But pit cells, they reside in the liver throughout our life, so they are locals, for the liver. And in some textbooks, you may find the information that they are located in the space of descent. so that's not true. They are really located in the lumen of our blood capillaries. And here the interaction of the Kupffer cell and the pit cell is shown. As you may see, some tumor cells which are attacked by pit cells, they undergo the process of apoptosis, and after that they are phagocytosed by Kupffer cells. So Kupffer cells, they're like scavengers. They phagocytose not only red blood cells, bacteria, or some foreign particles, but also dead cells. And besides, lots of neutrophils also present in the liver, as blood coming from the small intestine and large intestine, it contains lots of debris. There are lots of bacteria, commensal microbiota is there in our intestines. So they produce lots of antigens which are absorbed with the portal blood. So liver should neutralize all of them in Kupffer cells. That's why they are so numerous. That's why they are included, integrated in the endothelial lining of our sinusoids, because they phagocytose everything. Okay, so after that, one more cell population should be mentioned, very important. These are the eta cells. And what I want to highlight, this is the subject of eternal confusion. Hepatic stellate cells, these are the eta cells, lipid storing, and they are located in the space of this cell. They contain lipid droplets and they store vitamin A. Well-known facts, but at the same time you should not confuse hepatic stellate cells with the hepatic stellate macrophages, because if we return here, you may find that Kupffer cells, they are called stellate sinusoidal macrophages. So after the word stellate, you should add cells or macrophages. Okay, so do not confuse, because these are quite different cell populations. What's interesting about eta cells? They participate in the regulation of vitamin A concentration in our blood. As we have said at the beginning, liver performs the function of regulation of vitamin concentration. Vitamin A, it is the precursor for retinaldehyde, which is used like our visual pigments. So this is the normal function, but under some severe circumstances, for example, due to prolonged intoxication, eta cells, they might be transformed into myofibroblasts. And in this way, they stimulate the liver fibrosis by producing collagen type 1 and 3. What is the essence of this process? If lots of toxins are regularly circulating in our bloodstream, or due to intake of some drugs, for example, or alcohol, for example, as well, eta cells, they try to protect hepatocytes from those toxins, and they start to produce collagen in the space of this. This is the protective measure. It protects from toxins, but at the same time, it violates the process of metabolite exchange between the blood and hepatocytes. So as a result, liver fibrosis results in the replacement of hepatocytes with the connective tissue, and liver cannot perform its function. So eta cells are the target of modern therapy destined to prevent the development of liver fibrosis, because exactly those cells are responsible for this phenomenon. So please remember not only its normal function, but its role in the diseases. Then here eta cell is shown. Notice it contains lipid droplets, of course, and because vitamin A is lipid, it's hydrophobic, it is dissolved in lipids, so it stores lipids and vitamins together. And this is the Kupffer cell. You notice that lots of rubbish material, phagocytosed, is present inside the Kupffer cell. So Kupffer cell is present inside a lining of the sinusoidal capillary, while eta cell is represented between the sinusoidal wall and hepatocyte in the space of this cell. Okay, after we have discussed morphofunctional units of liver, its sinusoids with associated cellular populations, we have to discuss bile ducts, another system of channels present inside liver lobules. So as we have already said, every hepatocyte is faced both to the blood and to the bile, and bile circulates in between hepatocytes in the opposite direction to the interlobular bile duct, which is the part of the portal triad. So the first elements of the bile system in our liver is blind-ended bile ductules, which are lined by hepatocytes themselves. So bile ductules, they don't have their special lining. They represent two adjoining surfaces of hepatocytes, and of course they are sealed with the tight junctions, which are shown with arrows in this transmission electron micrograph. Okay, so let's look at this diagram. It again showing us the bile canaliculi and liver sinusoids by each side of the same hepatocyte. Yeah, notice that those cells, they have some cilia on their top surface. Maybe the function is not very well understood, but maybe to regulate the flow of the liquid inside them. And let's discuss the other elements of the bile tree. So the first element is the bile canaliculi. These are the terminal sites where bile is produced. So hepatocytes, they produce bile and they line bile canaliculi. And after that, canals of Henry is located, and we should pay special attention to the site of the liver, because you know the regenerative medicine is one of the very promising tools in the modern medicine. So canals of Henry are interesting because this is the hepatic stem cell niche. It contains stem cells which can give rise both to the hepatocytes and bile duct system. So by division, they may replace hepatocytes. You know that hepatocytes themselves, they can divide, and liver, it has very high regenerative capacity. But it is very important to understand that after chronic or acute liver injury, what cells can especially be useful, and which cells should be stimulated as they have the high regenerative capacity comparing with others. Okay, so after the canal of Henry's intrahepatic bile ductules are present, they are lined with the special cells cholangiocytes, and even the canals of Henry, hepatocytes and cholangiocytes are interspersed. They are both present, yeah. Then here only cholangiocytes. And after that, the interlobular bile ducts and right and left hepatic ducts and all another system, you know, from anatomy. Eventually, bile duct is fused with the Wirsung duct coming from the pancreas, and they have the common opening in the duodenum. So the general information about the bile, it is needed to digest fats as it emulgates lipids, breaking down them into smaller droplets. Yeah, and also it activates some enzymes and participates in the excretion of many substances. So many terminal products are excreted in this way through our intestines. Then, after we have discussed the liver, we should say several words about the gallbladder, as it is often inflamed in people with different which are predisposed or which intake lots of fatty food. So gallbladder, it has its lining in form of simple columnar epithelium as well as intestines. So it is formed in embryonic development from the endoderm as the outpouching of the digestive tube. Then lamina propria is present, and pay attention here, there are lots of fenestrated capillaries and some mucin producing glands. Why capillaries are fenestrated here? Because the main function of the gallbladder is to absorb water to concentrate the bile, and this concentrated bile is further excreted to the duodenum. So the concentration and storage of bile. To concentrate bile, water should be taken out. So we'll discuss this process in the next slide. So water is absorbed through the fenestrated capillaries. After that, muscularis externa. Notice that submucosa as well as muscularis mucosa, they are absent. And in the gallbladder, the mucosa is in contact with the muscularis externum. This layer of smooth muscle cells is not separated into layers. Yeah, so here we can see the mixture of fibers oriented in different directions. And the outer surface is covered either by adventitia or serosa, depending on the site where it is in contact with the liver or not. And how water is absorbed in our gallbladder. First step of water absorption. This is the active transport of sodium chloride and bicarbonate ions through the basolateral surface of those columnar cells. So in these basolateral surfaces, they have lots of pumps pumping actively sodium and chloride out of the cell. In this way, between the cells, those spaces are filled with a hypertonic solution. Hypertonic because lots of sodium and chloride, And if hypertonic solution is here, then water passively follows sodium and chloride. Then water is taken out of cells by just process of simple diffusion or osmosis through special exocrine channels. Exocrine type 1 and 8 is present there. So do not forget that water can be transported across the membrane, but as it is more or less charged, it is a charged particle, it is more readily transported through special exocrine channels, which have the hydrophilic core. And in our gallbladder, the type 1 and 8 is present. So and the process of bile absorption is guided with the help of those two steps. Notice how many mitochondria they have, as they need energy to do that. Okay, and the last component of our lesson, of our lecture, is pancreas. Pancreas is a very well-known gland, as it has its exocrine and endocrine portion. And first we are going to discuss its exocrine part, which is represented by acini. Pancreas is resembling our parotid gland, salivary gland. As one lesson before, we discussed large salivary glands. And you remember that they also had terminal portions and duct system, and terminal portions, they were of serous and mucus type. And in our pancreas, we also have those serous cells, which are called acinar cells. Acinus is the type of secretory portion, alveolar in shape. So cells of this acini, they are pyramidal in shape, and they have the zymogenic apical pole and homogenic basis. In the zymogenic pole, oxyphilic granules with inactive enzymes are present, while at the base we have very well developed rough endoplasmic reticulum and ribosomes, which are negatively charged due to RNA. Ribonucleic acid, so the base is basophilic, while apex is acidophilic. Easy to remember, and please keep in mind, because this is the feature of those cells. When you're going to draw, pay attention that the same cell should be colored with a purple color at the base and pink at the apical portion. Okay, so the general function of exocrine portion is to produce enzymes, lots of enzymes. You know that after hydrochloric acid has already digested lots of organic molecules in the stomach, chyme enters the duodenum, and here specific enzymes start to work to break those small particles of lipids, proteins, nucleic acids into smaller and even monomers. So here lots of peptidases, proteinases, lipases are produced, and they all have very important function for the process of digestion. Those enzymes are produced in inactive proform, and they need to be partially cleaved in the duodenum under the action of enterokinase. You remember this enzyme is produced, we discussed it in our previous lecture, by enterocytes, and it is located in the glycocalyx above their microvilli, and exactly this enterokinase it breaks down the inactive enzymes into active, and then they activate others, so there is a chain of reactions. If digestive enzymes become active inside the pancreas, it starts its self-digestion, and of course it results in the acute inflammation, and these are very severe diseases. So under normal circumstances, enzymes are not active. Then, next element of the acinus is the intercalated duct. You see, this is like a drinking straw element inserted inside the acinus as in the glass of water. So those intercalated ducts, you remember they were also present in parotid gland. They are lined with a simple squamous or cuboidal epithelium, and central acinar cells, they are known because they not only transport the pancreatic enzymes, but also they produce bicarbonate ions and water. So here we have to remember about enteroendocrine cells, also from the previous lesson. You remember they were producing secretin and cholecystokinin. So first, secretin works to stimulate those centroacinar cells to produce bicarbonates and water. Those elements are needed in the duodenum to neutralize the acidic pH of the chyme coming from the stomach. After that, cholecystokinin works. It stimulates acini to exocytose their digestive enzymes. So cholecystokinin and secretin, they stimulate pancreas to produce different type of content. Do not forget, so the first wave of pancreatic secretion, this is the water and bicarbonates. The second wave, driven by cholecystokinin, stimulates, it includes the secretion of enzymes. Okay, let's move on. And after we have discussed the exocrine portion of pancreas, we should discuss its endocrine part. And it has a very crucial role in the regulation of our glucose level. You all have heard about the diabetes mellitus, which is the impossibility of insulin to perform its action, for example, when the sensitivity to the insulin is lost or when insulin is not properly produced. And these are the very widespread diseases. So to understand how to cure it, what is the nature of the diseases, you have to understand what's there inside the islets of Langerhans. First, the most numerous cells in our islets, these are the A cells producing the, the not very numerous cells, but the type A cells, they're a little bit acidophilic, that's why they're A cells, and they produce the glucagon. You know that glucagon, it increases the blood glucose level. After that, beta cells, they are the most numerous and they're a little bit basophilic comparing with others, and they produce the insulin. Insulin, it is called because it is produced by the islets of Langerhans. Yes, so name is connected with the structures. This hormone, of course, it decreases the blood glucose concentration. This hormone is produced directly after the food intake. And nowadays, what is very interesting for clinical correlation, a very promising direction in the regenerative therapy is to take stem cells out of the patient's adipose tissue. You know that mesenchymal stem cells could be readily obtained from the abdominal fat during the liposuction procedure, which is widely used in cosmetology, especially in the United States. And after that, some mesenchymal stem cells are obtained out of there and transformed into beta cells and returned to the abdominal fat, not even to the pancreas. And in this way, patients, with the help of the cellular therapy, they can return to the natural insulin secretion. So insulin should not be injected no longer. But nowadays, only as far as I know, only clinical trials are performed in this direction, but I think they are very successful. So you should understand the structure of those islets as in future cellular therapy should be very, I think it will be very widely applied all over the world. So except those two, there are some delta cells producing somatostatin. We have already mentioned somatostatin because it was produced by the hypothalamus. Also, it is produced by the liver. Do not forget, it inhibits the activity of the growth hormone. And locally here, delta cells, they produce somatostatin, which inhibits the exocrine and endocrine activity of the pancreas. So the word statin, this part statin, should highlight its inhibitory function. And at last, the F cells or pancreatic polypeptide cells produce the pancreatic polypeptide. The function of those peptides are not very well known, so no very important to discuss. First of all, you should remember and memorize those three cellular subtypes. Okay, and this is the end of the lecture. Thank you for the attention.